Hemodialysis saves lives for chronic kidney disease patients, but creates a hidden crisis: relentless muscle loss and crushing fatigue. While dialysis cleans blood, it cannot replace muscles. Without intervention, muscles waste away, taking your ability to stand, walk, and live independently. Today, we're exploring how dialysis patients can protect physical function against sarcopenia and fatigue. Dialysis profoundly impacts every life aspect. Among the most devastating problems are muscle loss and fatigue that refuses to lift. Japanese dialysis registry data shows that as dialysis duration increases, daily living activities decline and independence erodes. Frailty and sarcopenia rates among dialysis patients are 2 to 3 times higher than general elderly populations. But this decline isn't inevitable. Research proves that with proper exercise, nutrition, and lifestyle adjustments, dialysis patients can maintain and improve physical function. Dialysis requires 3 sessions weekly, 4 to 5 hours each, forcing prolonged inactivity that reduces physical activity. Water removal during dialysis causes temporary hypotension and ischemic changes in muscles and nerves, triggering fatigue and chronic activity aversion. Potassium restriction, protein restriction, and appetite loss worsen nutritional status. When nutrients supporting muscle synthesis become insufficient, muscle mass and strength decline, creating secondary sarcopenia. Why do dialysis patients develop sarcopenia easily? Risk factors include chronic inflammation, where kidney dysfunction causes inflammatory cytokines to chronically elevate, promoting muscle, protein breakdown while suppressing synthesis. Metabolic acidosis occurs when kidneys cannot adequately excrete acid, accelerating muscle protein breakdown. Nutritional intake insufficiency develops as dialysis patients face protein, potassium, and phosphorus restrictions. Physical activity decreases dramatically on dialysis, days requiring prolonged rest. Endocrine changes see testosterone, growth hormone, and insulin-like growth factor secretion decline, weakening muscle synthesis signaling. Multiple studies show sarcopenia in dialysis patients correlates with increased mortality and hospitalization rates, decreased quality of life, and elevated fall and fracture risk. Chen's 2017 research reported dialysis patients with low lower limb strength and walking speed faced significantly higher mortality risk within 1 year. Sarcopenia isn't merely a muscle problem, but determines life prognosis and quality itself. Evaluating sarcopenia requires not just muscle mass measurement, but muscle function indicators like grip strength, walking speed, and chair stand tests. Focus shouldn't be just weight, but whether patients can move, walk, and avoid fatigue. For chronic kidney disease patients, being easily tired, unable to move, and quickly breathless represents exercise intolerance, severely restricting daily life. This decline begins early, around stage 3 chronic kidney disease, due to quietly progressing muscle. Metabolic abnormalities and oxygen transport capacity decline. Anemia from erythropoietin deficiency compounds oxygen transport decline. After dialysis initiation, this tendency becomes more pronounced. Exercise intolerance factors include anemia. Reducing oxygen supply as kidney function decline decreases red blood cells. Mitochondrial function impairment occurs as chronic kidney disease reduces muscle cell, mitochondria number and function. Muscle fiber type changes see endurance fiber atrophy. Circulatory dynamics changes during dialysis see massive water removal, causing temporary hypotension, restricting blood flow to muscles and brain. Chronic fatigue afflicting dialysis patients isn't simple tiredness, but deep fatigue, not recovering with rest. Approximately 60 to 90% experience some fatigue, hindering daily life, exercise habits, and treatment motivation. Fatigue encompasses physical fatigue with muscle endurance decline, mental fatigue with reduced concentration and depression, and motivational fatigue with drive loss and social withdrawal. Why fatigue? Anemia and low oxygen states cause tissue, oxygen supply insufficiency, post-dialysis acute body fluid and electrolyte fluctuations, cause weakness and dizziness. Chronic inflammation disrupts brain neurotransmitters, causing depressive symptoms. Sleep disorders plague many patients with insomnia and restless leg syndrome. Improving fatigue requires aerobic exercise. Improving whole body metabolism through moderate intensity exercise. 2 to 3 sessions weekly, improving muscle blood flow, enhancing mitochondrial activity, and promoting serotonin and dopamine secretion. Resistance exercise recovers muscle strength, particularly quadriceps and core muscles, directly connecting to recovering basic movements. Cognitive behavioral therapy addresses psychological factors, deeply involved in chronic fatigue. Intradialytic exercise during dialysis prevents post-dialysis fatigue, while providing time-effective utilization. Previously, recommending exercise to dialysis patients was shunned as burdensome and dangerous. Recent research dramatically changes this thinking. Appropriate exercise during dialysis and interdialytic periods actually enhances patient prognosis and quality of life. Intradialytic exercise during the 4 to 5 hour period utilizes lower limb pedaling, resistance bands, ankle exercises, and abdominal breathing. Benefits include time-effective utilization, exercise habit formation, improved dialysis efficiency, and fatigue reduction. Interdialytic exercise on non-dialysis days includes aerobic exercise, 3 to 5 sessions weekly like walking or cycling, 20 to 40 minutes. Strength training, 2 to 3 sessions, weekly targets. Lower limbs with squats and leg extensions. Upper limbs and core with resistance band exercises, 1 set 10 to 15 repetitions. Flexibility and balance practice. Includes stretching and dynamic balance training. Safety concerns about exercise burden show extremely low adverse event rates. Fewer than 1 per 10,000 sessions. Multiple studies prove exercise therapy provides improved maximum oxygen uptake, enhanced walking distance and mobility, maintained muscle strength and mass, improved dialysis efficiency and improved quality of life, depression and fatigue. Exercise is becoming recognized as medicine itself, with dialysis facilities increasingly staffing physical therapists, providing routine exercise therapy. Internationally, the exercise is medicine. Concept positions exercise as medical treatment. Moving during dialysis and between sessions protects muscle, strength, mental health, and life quality. Dialysis patients can maintain dokeru career, a body that moves with appropriate knowledge and approach. Thanks for watching. Please hit that subscribe button and give us a thumbs up.